Welcome back. As COVID cases surge across the country, the CDC is warning that smoking cigarettes or vaping increases the risk of severe illness from the coronavirus. That's because, in part, smoking harms your lungs. Now, because a lot of smokers and vapers are young adults, many medical experts say now is the perfect time for them to quit and to prevent them from starting in the first place. So joining me now live are Dr. Susan Bailey, president of the American Medical Association, and Matthew Myers, president of the Campaign for Tobacco-Free Kids. Good morning to both of you.
Good morning.
Good morning.
Dr. Bailey, we're going to start with you. We kind of touched on it. It's about the lungs, it's about your organs. How are smokers and vapers at high risk if they get COVID-19?
We've known for a long time that smoking damages your lungs, and anything that damages your lungs can put you at risk for severe disease if you catch COVID-19. But now we realize that those who smoke e-cigarettes or vape, and there are a lot of youth in that category, are also at higher risk. And now is the perfect time to think about quitting. It'll help protect you from COVID-19, just like wearing a mask, washing your hands, and keeping your distance.
Yeah, and one of those things, Matthew, that can help is the talk, that parents are going to have with their kids if they don't do it on their own. Just curious, how do you think they should go about that? Because oftentimes kids may not want to listen to their parents.
Well, it's a great question, and it's never been more important, both because COVID-19 makes the health crisis even more urgent time-wise, and because we know that many kids who use e-cigarettes use flavored e-cigarettes. They don't realize that the product itself is harmful. They don't realize that the product itself is addictive, and they don't realize that the product itself actually harms their lungs. So this is one of those occasions where what we're recommending is that parents sit down with their kids, not to preach to them, but to talk about the honest, straightforward facts. What we have discovered is that when parents and kids have a truthful, objective conversation, it makes a big difference. We have put on our website a number of resources to actually help parents have that conversation. So if parents are concerned, they should go to tobaccofreekids.gov and get free resources advising them how to have a conversation with their kids to have the greatest impact. I want to add one thing. It's important for kids to have a conversation with their parents. Many parents are still smoking, particularly in the African American community with menthol cigarettes. And this is the perfect time for parents and kids to support each other.
And doctor, I want to talk to you as well in terms of smokers and vapors to quit now, basically to protect their health. Oftentimes we heard, at least with vaping, when it first came out, it was fine. It didn't hurt you, and now we're finding out different. What do you think about that?
We realize now that the vapors involved in e-cigarettes contain a lot of harmful chemicals that can damage the lung. And vaping is a great way, unfortunately, to get addicted to nicotine. Nicotine levels are higher in e-cigarettes than they are in traditional tobacco cigarettes. So even though you think it's harmless, you can become addicted to nicotine very, very quickly, which makes it, number one, very difficult to quit, and number two, can be a gateway to smoking tobacco, which can be even more harmful to the lungs. And there are great resources to help you quit. The CDC has a helpline, 1-800-QUIT NOW, and on the internet, smokefree.gov.
All right, Dr. Susan Bailey and Matthew Myers, the president of the Campaign for Tobacco-Free Kids. Thanks for being here. We do appreciate a lot of good information.
Thank you.
Thank you very much.
Not a problem. If you like more of that information, you can go to fox59.com/links. Angela?